The first AIDS cases were reported in Botswana in 1985. Since then, the HIV and AIDS epidemic has been increasing at an alarming rate, and as of 1995, Botswana ranks as one of the 4 hardest hit countries in the world. More than 25% of adults ages 15 to 49 are HIV positive. This means an estimated 190,000 adults and 26,000 children under the age of 5 are living with HIV and AIDS. The highest HIV prevalence rate is among 20 to 39-year-olds. The mean age of death due to AIDS in Botswana is 25 in females and 35 in males. These are the most reproductive and economically productive years, therefore threatening the country's population growth and workforce in the coming years. In addition, the number of deaths due to HIV and AIDS is projected to rise by 208% between 1995 and 2015. Botswana has one of the most mobile populations in the world, with people shuttling between cattle posts, land areas, large villages and towns, and South African mines and farms. This pattern of migration has been a factor in the dynamics of evolving co-epidemics of tuberculosis, HIV and AIDS, and STDs. Tuberculosis itself accounts for 44% of deaths in HIV and AIDS cases. However, our focus is on mothers and children with HIV and AIDS. 43% of Botswana is under the age of 15. The HIV epidemic has a disproportionate impact on children, causing high mortality rates among infected children and orphaning many others. It is estimated that 20 to 33% of children will be orphaned over the next decade as the adult death toll climbs. Approximately 25 to 33% of infants born to HIV-positive mothers will also become infected with HIV. Among the African countries with the highest HIV prevalence rates, Botswana has been the most affected in terms of infant mortality. In addition, due to gender norms and inequalities, young girls and women are regularly and repeatedly denied information about and access to condoms, and often do not have the power to negotiate the use of condoms. Our plan is a 1-year study with possibility for 2-year renewal following the analysis of results. National condom distribution is already set in place by the government of Botswana. 95% of Botswana have access to condoms. The main parts of our plan are to support national condom distribution, which is already set in place by the government, scale up testing for all eligible patients and those with high viral loads, and especially prevention of mother-to-child transmission. Prevention of mother-to-child transmission includes routine HIV testing for all pregnant women, training to increase available health workers and managers, counselors and educational materials for young women for preventing unwanted pregnancies and HIV infection, and free formula for all HIV-positive mothers. Evidence from previous studies in other African countries showed that exclusive breastfeeding for up to 6 months was associated with more than 50% reduction in the risk of transmission of HIV, compared with non-exclusive breastfeeding. There is a limited understanding in Botswana of the dynamics of AIDS and its impact on society. Aggressive public outreach campaigns and education interventions must continue to target key high-risk populations, especially among the youth. There are also limitations of social welfare for orphans and caregivers, so decreasing the number of orphans in the next coming years is critical. Some of the measurable outcomes of the program are the number of mother-to-child transmissions after 1 year of implementation, the popularity of the clinics and the formula, the number of new infections, and then after 1 year, improving this program and measuring that success after another year. For the budget, we'll be taking money from the National AIDS Council, which is chaired by the Minister of Health, and it is the HIV and AIDS policy-making body. It was established in 1989, and it takes a lead role in the prevention and care of HIV. The majority of our budget will be on testing, formula, as well as education about HIV and AIDS and prevention, as well as safe sex and condom distribution to supplement that existing program, as well as advertisement, staff training, and the formation of our 8 all-female health centers.